Mr. Speaker, I have spoken a lot about the need for establishing measurable targets for priority implementation, and today I want to put that lens on our priority for access to health care. When we set this priority, what I specifically meant by it was putting a focus on ensuring everyone in the NWT has access to primary care. Since setting that priority, we have seen the Premier establish the Healthcare Sustainability Unit, and most recently, the Health Minister appointed a new public administrator for the NTHSSA. Together, these changes are heavily focused on the financial aspects of system sustainability, but I question whether we have appropriately weighted the importance of access to primary care in our healthcare goals and planning. I will acknowledge that the public administrator's mandate does include primary care reform, as does the business plan, but similar to my concerns about other priority areas, I think we need to be more specific about what exactly we are working to achieve. Indeed, Mr. Speaker, when I look to the business plan for the Health Department, I note several key items. One is that an integrated primary care framework is developed and performance monitoring is in place by 2025. Great first step. However, there isn't a target identified for what this framework is meant to achieve. Second is that performance measures are established and trended to identify improvement areas, but the target is listed as target not established. So we have some work to do. Together, these targets don't tell MLAs or the public what outcome we are trying to achieve with primary care reform or prioritization. As I said last week, if we don't communicate what we are trying to achieve, it is impossible to know when we have achieved it. In her book, Health for All, which I'm happy to note I saw on the Health Minister's desk, Dr. Jane Philpott suggests that leaders need to articulate a vision, and I emphasize, with a measurable end result. Dr. Philpott suggests the goal at the provincial and territorial level needs to be universal access to a primary care team. Our goal should be everyone in the NWT has access to primary care. I think that the department is working towards a goal like this, but it is not clear that is indeed the goal or when we expect to achieve it. So let's make it clear, Mr. Speaker. I'll have questions for the Minister at the appropriate time. Thank you.